HIV/AIDS continues to be a major public health concern in Guyana since its first case was reported in 1987. Since then, the Ministry of Health has provided a number of clinical and technical interventions in the fight against HIV/AIDS through the National AIDS Program Secretariat established in 1992. Though the country has made significant progress towards meeting the first goal of the Unaids HIV/AIDS prevention program, achieving two targets has been an arduous task. The targets outline that 90% of all people living with HIV should know their status, 90% of all people diagnosed with HIV should receive sustained antiretroviral therapy, and 90% of all people receiving antiretroviral therapy should have viral suppression. To date, 95% of the 8,752 persons currently living with HIV know their status. However, 71% of them are receiving sustained treatment, while the viral suppression rate stands at 69%. In an exclusive interview with Nightly News, manager of the National AIDS Program Secretariat NAPS, Dr. Temika Rodney was asked about some of the difficulties encountered in achieving the required targets.
So most of the challenges would be in terms of having specialized testing for viral load, drug resistance, continued testing in terms of we would have had cases of the equipment in order to do these testing. We don't have sufficient amount, but now that has been addressed. The drug shortages that would have been there would have affected people being achieving those viral suppression. Additionally to that, we would have had access to persons who are HIV positive not accessing the drugs. So it's a complex, multi-faceted issue.
Minister of Health Dr. Frank Anthony, in responding to a question recently from the media in relation to shortages of antiretrovirals, assured that his ministry is in the process of addressing those challenges.
We did do procurement. We went out, but unfortunately the agency that was tasked with bringing those medicine in, which is PAHO WHO, for the HIV meds, they were not able to get those meds into Guyana on time. And that created a shortage for us. We have since had to supplement by buying additional medication while we wait on those that were already paid for. So we went and we buy from other suppliers. And so we have now been able to address some of the antiretroviral shortages.
Dr. Rodney added that NAPS, in partnership with civil society groups and other stakeholders, have streamlined surpassing those targets as an area of focus in the current HIV National Strategic Plan, which promises to strengthen the national response to HIV/AIDS. Temika Rodney reporting for the HGP Nightly News.